Hi, Shawn McClelland's Mac Benefits, your Medicare and Health Specialist. In this video, I'm going to do a high-level overview of Medicare and specifically how it relates to supplements. If you need a deeper dive into Medicare, you can go to my YouTube channel and look up the Deep Dive series and select Medicare. So let's get started. So Medicare has parts, Part A and B and Part D, and then there's Part C, which is a combination of the three. Part A and Part B are what's called original Medicare. So you'll hear that term, original Medicare. They're just referring to Part A, hospital and skilled nursing, and Part B, which is the doctor's office visits and any outpatient care. Then you would add Part D to that combination of original Medicare, and that's for your prescription drugs. And that's a private health plan that you would select from healthcare.gov, and you would put in the prescriptions, specifically the amounts and everything that you take, and then what pharmacies you want to use, and then it'll come back with starting from the lowest cost on up for the combination that you need. Now that needs to be reviewed every year because those plans change. The drugs are come and go, how much they pay for drugs come and go, the pharmacies. So every year you want to take a look at that Part D, and we'll do that as a part of an annual review. Then you would add a supplement to pay for the pieces that Part A and B, the portion that is your co-insurance, so 20% of the Part A and B less the deductible, then you would pay. Most supplements or all supplements pay the Part A deductible, but I'll show you that the newer ones, we're now not allowed to pay the Part B on behalf of the patient. But this allows you, this meaning original Medicare, this combination allows you to go to any doctor, any hospital without any kind of a network restriction. I'll talk about that in just a moment with the doctors. So the initial enrollment period is around when you turn 65. So it's all based around the month that you turn 65. So you have 3 months prior to your 65th birthday, the month you turn 65, and then 3 months after. So a total of 7-month span. So this is when you can enroll and have no health questions for your supplement. So the Part A and the Part B, the Part A gets enrolled automatically. Part B, most people it goes automatically, but sometimes it doesn't and you have to go in and enroll, and I can help you with that. But this time period allows you to get into your Medicare supplement without any health questions, so it doesn't matter what your pre-existing conditions are, no health questions. Now, if you wanted to make changes, so maybe year 2, we decide that we need to save some money, or we want to take advantage of some lower costs and go to a different plan, or you're somebody who's already on a plan and we want to take advantage of the same costs and maybe benefits, then it would require underwriting. So then we'd have to answer questions in order to change plans. So also around starting in October, you would start hearing, way before that, you would start hearing about all these open enrollment and election periods and enrollment periods. And then to add to the confusion, healthcare.gov, so the under 65 healthcare, also has an open enrollment during that time, which starts in November. So this October period, this is the only one as an original Medicare with a supplement. This is the only enrollment period that you need to, or an election period that you need to pay attention to. And it's the annual election period. And you don't really need to remember this. I'll be sending you emails reminding you that we need to go in and review your drug plan and make sure you're on the right supplement for the next year. But it's during October 15th to December 7th. During that time period, you can change or sign up for a new Part D or Medicare Advantage plans. So the Part D, if we need to say they did make some changes to maybe what pharmacies you use, or the drug just isn't paying the same anymore, this is the time period that we can go in and make changes to that. Now, any changes that we make during this period would be effective January 1 of the next year. So that's the at a glance of Medicare. Again, if you need a deep dive, go and look for my deep dive series on YouTube. So Medicare and You, this is the dictionary for Medicare. Everything you need to know is on the Medicare and You guidebook. Now you can find a copy of this. You should be sent a copy of this when you turn 65 or as you're coming up to it. But if you don't have a copy, there's two ways you can get it. You can get it electronically like this. You can just type Medicare and You and the PDF from from Medicare.gov. You'll see download the PDF of the current year. The one I'm referencing here is the 2023 version. Now the other way you can get it is just to go to the Social Security office, and they have them in the lobby in Spanish and English. You can get a paper copy, which I suggest that you would do both. The electronic version is easier to search. You can just do there's a little search feature on the PDF viewer typically, and you can search for whatever term you're looking for, and it'll show you exactly where to go and look for those terms. So we're going to look at the Medicare supplement section. So this is on page 75, and we're going to look at 75 and 76. Medicare calls supplements Medigap because it's filling the gap. It's filling that last 20%, and it used to, the older plans, I'll show you, that paid the deductible as well. So how does it work? So the main thing I want to point out is that these plans are all standardized. So all these different companies that offer plans, they all have to pay them the same way. That is actually by federal law and state law that they have to pay them the same. So this is to make it so that you don't get confused by one plan to another. And you also notice here they all have the same, it says right there, same basic benefits. So the variants you're going to see are the additional benefits. So the health club memberships or wellness programs, things like that. Those are some of the additional benefits that you'll see with different carriers, and that's typically what the difference in the prices are. Also, the difference in prices are what plan you're on and how fast they increase. So I said earlier that there are some plans that they no longer will pay the deductibles. So specifically, it all has to do with when you joined Medicare. So when you became eligible. So if you're after January 1st, 2020, then you can no longer get into a plan that pays that Part B deductible, like it says right there. You can no longer pay that on your behalf. So the Part B deductible, and I'll show you how much that is. So if you started Medicare before that date, then you can get into the Part B. So the plans that paid that before were Plan C and Plan F. So we'll get into the different plans here, but if you were before that date you became eligible for Medicare, then you could move in and out of a Plan C or a Plan F to other plans, and then you could go back if you wanted to. But for those who are after January 1st, 2020, you are no longer eligible to get into Plan C or F. So let's look at that. So the plans across the top here, this is page 76 in the Medicare and You guide. The plans are lettered A through N. Of course, they dropped some letters here, but A through N. Most of these plans, some of these plans it varies state by state, and some even just companies that the Medigap company doesn't want to offer all the plans. So they're labeled A through N. So we're going to look at F, G, and N. So I've highlighted those here. The other side here, you see, these are the benefits that Medicare pays 80% of them or not at all, and this is telling you the percentage of the portion they don't pay that the Medigap plan pays. So you see on Plan F, it's 100% all the way down, except for foreign travel, but they're all the same, like the foreign travel. And if you're going to be traveling and you want to make sure that you have good health care and you want to make sure you get home if you get sick or injured, there are other plans that I would help you with that are really inexpensive, that are worth their weight to help make sure that you can get what you need while you're traveling. Because Medicare, it's a little complicated. It does have some coverage, but it's complicated. It'd be much better to have a different plan, a separate plan just for that travel. All right, so if you notice, they're all 100% right down the line. Now the difference between that and Plan G, you notice the only difference here is this X right here, and that is part of the Part B deductible. So the statement earlier that said that they can no longer offer to pay that Part B deductible, that's what this is denoting here. It does not pay that Part B deductible. So you see here that Part B deductible is $233 in 2022. Now that had been increased from 2021, but so now it's 2022. It's $233. So meaning a deductible, just like in the under 65, that you have to pay that first before anything else gets paid. And then some plans, like Plan N, I'm going to show you, has some copays that you would pay after that. So Plan G, you would just pay that Part B deductible, and then everything else would be paid by the plan. So that's the only difference there. So let's look at Plan N. So Plan N has a couple of notes here. So you see that it's 100% except for these two X's. So one of them is that Part B deductible, and the other one is excess charges. So we'll talk about that as well. So the first note, it says under Part B co-insurance or co-payments, Plan N pays 100% of the Part B co-insurance, the 20% that Medicare doesn't pay. You must pay a copay of $20 for some office visits and a $50 copay for emergency room visits that don't result in an admission. So say you, like for the $20 copay, you want to go see your family doctor just for wellness visit, something to that effect. You may pay a $20 office visit, but if it's the first time you've gone in the year, you may pay all of the visit just for the $233 doctor, the deductible. So remember, you always have to pay that deductible first, and then you would have copays. So this is just to help. The thought was that you've had some skin in the game. You would be a little more wise about your use of your health coverage. So some of those visits you'll pay $20. Now the only time you would pay this $50 copay for the emergency room is if you go to the emergency room and they don't end up admitting you. So say you felt like you were having some heart issues, you go to the ER and they said, well, it's actually just indigestion, or maybe they've discovered you have something else, but they send you home. They don't check you in, it's not life-threatening, you don't need treatment, so they send you home. That's when that $50 copay would come in. Otherwise, you would be admitted, and then the Part A hospital plan would pay for that. All right, so the Part B deductible is one of the differences, same as Plan G. The other one is that Part B excess charges. Plan N does not pay for those Part B excess charges. So the question is, what is an excess charge? So when physicians start to, when they join, open their practice and they say, yes, we're going to accept Medicare patients, they sign a document that says, we will accept the Medicare allowable amount. Well, the Medicare allowable amount, Medicare establishes every procedure, every treatment, every visit has a code, right? Every box of tissues has a code and a price next to it. So that price is what Medicare pays for that code, right? So everything has a code. It's just like every product in the store has a barcode on it, similar, but this is all healthcare. So doctors, 97% of the doctors, when they signed up for Medicare, they said, yes, we'll accept the Medicare allowable amount as paid in full, meaning they're not going to charge anything extra, which would be an excess charge. And even if they do, so say they decide to be one of the 2% that decides to do some kind of a hybrid plan that allows them to take the Medicare allowable for some things and then charge some excess for other things. So it's kind of a case-by-case basis where they decide which one they want to go, which route do they want to go. And when they do that, you have what the doctor charges, then they subtract out the Medicare allowable amount, and then that would be the excess charge. but they also limited to what they can do. How much can they charge? They can only go 15% more than this Medicare allowable amount. So they're not able to just charge whatever they want. They're actually limited to how much they can charge. The third option that a doctor can do is they can just opt out. They can say, I'm not going to participate in Medicare at all, and we only take private pay. So everything's out of pocket. So of that 1%, so of the doctors that took 1%, which is not very many, it's right around 1,000 of the total amount of doctors who accept, 47% of this 1% are psychiatrists. So you know that when you go to see if you need anything that has to do with mental health, I'm going to show you how to look it up. But I'm also going to show you how to look up whether or not your doctor it takes the Medicare allowable. But this is the thought. So it's a very small percentage of doctors who don't take it, and then of those small percentage, there's very specific specialties that opted out. So does my doctor take the Medicare allowable? Let's take a look. So at Medicare.gov, you can go right here to Find Care Providers, and when you click that button, it takes you to this page where you can put in your zip code and then select here. So you would pick maybe family doctor or podiatrist or whatever you're looking for, and then just click search, and it'll go around your zip code. Now, if say you go to see a doctor in another city, again, just put the zip code for that city and then look up that provider. What you're going to get is something like this. So it's a list of doctors, and then you'll see right here, it'll say, let me blow that up for you. It says here, charges the Medicare approved amount. So you pay less out of pocket, meaning that they accept the Medicare allowable amount as paid in full. So you're not going to be charged excess charges. Again, 97% of the doctors who take Medicare, this is the way they do it. So it's really not an issue unless you're going to go to one of these specialists. Then you just want to ask ahead of time to make sure that that you know how much it's going to cost. They have to tell you up front. So that's Plan N as a whole. Plan N, I believe, is one of the best plans to go into because they're basically saying that, well, if you're willing to have a little more skin in the game, so you're willing to have a few co-payments here. Now, this hasn't changed. The Part B deductible did not change from the Plan G, but you're willing to pay $20 for some doctor visits and possibly the $50 if you don't get checked in to a ER visit. And the really not an issue excess charges. There's really not a big difference between the Plan G that says they'll pay those excess charges, since 97% take regular Medicare as paid in full. So this really isn't an issue. So Plan N is also, and let me show you how many people select Plan G versus Plan N versus Plan F. And this will show you how the growth affects the rates. But let's do a little bit of math. So I had a client that was on a Plan F, and we were able to find a Plan N for him that saved him $100 a month. So that's $1,200 a year. Now the Plan N patient pays the $233 Part B deductible, just like the Plan G does. And then they have some copays for doctor visits, right? So after paying the $233 Part B deductible, and I did that because he was on a Plan F that paid the deductible for him, he still saves $967 a year just by going from one plan to the other and being willing to pay that deductible out of pocket every year before any copays. So now let's say, well, how many copays could I pay saving this $967 a year? How many copays would it take before I break even? So if he went once a month, which is 12 visits a year times the $20 per visit, he still saves $727 a year by going from Plan F to Plan N, and all of the other items are paid the same. So What if he went two times a year? Maybe he has some things that he's monitoring, and he goes twice a year or twice a month. So 24 visits a year, $480 annually. He's still saving $487 a year. And then, well, what if it's 36 times a year, $720 annually paid in copays? He's still $247 ahead. The point was that there's a lot of copays that you could pay and still be ahead, but it's only if you need it. So if he only needed to go once every couple of months, then on the Plan F, he was paying for these services if he used them or not. On the Plan N, you're only going to pay them when you use them. So it's a smarter purchase, I think. So let's look at how many people are on. This is as of 2010, so you can see the changes here. Notice 40% are on Plan F. Plan G was only 3% of the market because everybody wanted to be on Plan F. It was the easy plan, right? And a lot of agents would just put people on Plan F because it was the easy plan. It was the kind of a shoot it and forget it kind of a scenario. Plan G, the only difference we saw was the deductible. Plan N, we kind of have to search for it right here. 2% of the market was in a Plan N. Well, that was very expensive for Medicare, and so as of 2020, so here's 2018. So still before the 2020 where they stopped allowing people to get into Plan F. So now blue is Plan F. 52% of the market is in Plan F of those who are on Medicare supplements. 17% are on Plan G, and then M and N is this green one here, so 10% are on Plan N in 2018. What I'm showing you is the growth in this Plan F. So in 2010, it was 40% of the market. By 2018, it had become 52%. This is obviously growing very rapidly. So now let's look at 2021. Now this is a year after the 2020 stopped allowing people to join Plan F and now pushed them all to Plan G, the new entrances. So people can no longer get into Plan F, so the people that are left on Plan F are going to basically stay there until they are no longer in the plan, they pass away, or they move to Plan G or some other plan in order to save money or to reduce their benefits, reduce costs. So that's what's happening here. So this is a kind of a closed group, right? So the only ones that are going to remain there are those that's only going to shrink by either people moving out or passing away. So by the time we get Plan G, so Plan N is held steady at 9.9%, 10%. So the rates for Plan G are nice and steady. So another thing I would want to point out is that Plan F used to be, because it was the easy plan, and all of the agents would put people into Plan F because it was simple, wasn't much to go over. Now that you can't put anybody into Plan F, now that is happening to Plan G. So all of the agents are just putting everybody into Plan G. It pays the most people. It also pays the agents the most, comparatively. So what we really want is slow and steady growth, and we don't want the rates to be exponentially increasing because of the amount of people that are in these plans. So we're going to see this Plan F slowly get smaller and smaller. This Plan G is going to continue to balloon, and this Plan N, as you've seen with just looking at these 3 dates, has been nice and steady. So the only increases we're really going to see here are the annual increases that are just simply due to you aging to the next age, right? So it's called attained age. So as you go from 65 to 70 and 75 to 80, as you go from one year to year, not the jumps. So from 60 to 65 to 66, there's going to be a built-in attained age increase. So what we're going to see is in the Plan N, there's not going to be the pressure for the rates to increase, like there will be in the Plan G and in the Plan F, is going to be decreasing. But as this population decreases, they're obviously getting older and older, and they're getting more and more expensive to maintain. The rates for that Plan F are really going to go through the roof. The Plan G is going to be the one that's growing because all the new people are going into G, and there's no new people going into F. Plan N are going to be the consumers that are willing to pay maybe the additional copays and the same deductible that you'd have to pay in G, but paying those additional copays when you use it instead of paying for it whether or not you use it or not, right? So that's what we want to see, nice steady growth, and then we can watch that every year. You want to review this every year and make sure that we're on the right company that isn't having lots of large rate increases other than just the standard attain age changes. All right, well, I thank you for sticking around and being a part of this video. If you have any more questions, please reach out or watch more videos on my YouTube channel. Talk to you soon.